G'day everyone, this is Health Highlights. Health Highlights is a show about health professionals and the people and the stories behind the names that you hear about but you seldom get to meet. And today we've got a very special interview for you. We're here in the Rainbow Clinic. Now, I've been in the health industry for around about 20 years and I really don't know what OTs do. So today, Sarah is going to set us straight on everything to do with OT and what paediatric OTs do. How are you, Sarah?
I'm good, thank you, Simon.
Look, I have to say, I love your clinic. It is just amazing, and you'll see some footage of it coming through. It is just beautiful. It's nice and new. It's just such a great place for kids to come with all the colour and all the rainbows. But firstly, tell us about a paediatric OT. What do you actually do?
It's a good question.
Yes.
Yeah. So not a lot of people understand what occupational therapy is or what a paediatric OT does. So the more education and more information we can get out about our profession, the better. So I'm very honoured and to be speaking with you today, and it's a pleasure to have you in the clinic. So thank you for coming. Paediatric OT, we are pretty much providing children with the tools and resources and strategies that they need to become more independent in their activities of daily living. So activities of daily living, or our ADLs, are things like self-care. So we help children with dressing, eating and drinking, brushing their teeth, showering, bathing, fussy eaters. We work on them being able to hold a pencil, to write their name, to recognise shapes, colours, learn the letters and numbers. So handwriting, we work riding a bike, playing handball, so any of the hand-eye coordination. We help with motor planning or gross motor skills, which is climbing, the jumping, balance. So it's a huge area.
It is.
And it's pretty much ticking off all the boxes to do with children's independence in their daily living skills. And when they get to a bit older, we're helping the children type, so doing typing and handwriting speed, legibility. So we work right up into 18 years. And some of our older children with autism, intellectual delay, we're helping them with CV, interview skills, vocational rehab type stuff as well, so money, budgeting.
Wow.
So it's just a huge area.
So really it's just about helping them flourish in life and do the best they can.
Yeah, improve their quality of life. So it's a rewarding profession because you're actually seeing these children become, better and better at what they're doing, and it's a real privilege. Yeah.
So how did you get into being a paediatric OT? So what's the story there?
So I actually wanted to help people,
and
I have a general love for people, and I've always been a people person, not a computer person, but a people person. So I prefer communication, talking, those sort of skills I realised I enjoyed and was probably a little bit better at than computers or IT. So I got into the profession with the notion that I want to help others or serve others, and just a general love for people. I rang a friend that was an OT student at the time at Newcastle Uni, and I said, I'm tossing up between art psychology, dietitian or OT. Can you tell me a little bit more about OT? So it was my third choice at uni. After that conversation, it's my first, changed all my preferences. I have been doing PEDS OT since 2002 and haven't changed. Love it.
So,
still love it.
And look, you can see the passion just in this building and the fact that there's so much love you have for what you do.
Yes.
And it's demonstrated in that, so I think that's brilliant.
Yeah.
How does the actual therapy look? What are you doing with the kids to actually help them get to the goals that they need to?
Yeah, again, a good question. So we'll identify in the assessment where are their percentiles or where are they performing in relation to same-aged peers, and they'll get a baseline. Say we did some manual dexterity, so we were threading or lacing, or we were, copying shapes. We'd look at the fine motor coordination, and the assessment, it's a standardised assessment, spits out a percentile ranking. So how is that child performing compared to same-aged peers? If we're within less than the 15th percentile in the movement ABC assessment, we have to say that's a red flag. So we say, it's in the amber or red zone, we really need to do some intervention. And in that session we explain how many sessions we're likely to take to fix or improve that child's so you're giving them a bit of a time frame.
Yep.
Saying it's up to every child's different, they're going to progress at different levels, but we can say through experience I give you 4 to 5 sessions just on fine motor practice.
Yep.
And I start to see improvements within a month. So it's for us it's a great way to give them ideas to practice at home as well, so it's not just 1 hour a fortnight. It's not going to change the child. It's what you actually ultimately do at home or across the school setting that can help a child be more independent.
And I suppose that's one of the big questions that a lot of people would have as well. If we know that there's an issue going on, can't we just get them to do it at home?
Yeah.
Why do they need a therapist to get involved?
Exactly.
What would you say to that?
Yeah, and look, that's a really important part of it. The OT often the child works better for the OT than the parents, so yes. I'll just say that.
Yes,
sorry
I'm
guys.
A parent. Yeah, yes.
They're going to put up roadblocks or they'll have every excuse in the sun why they don't want to do the therapy. So they come to here at the Rainbow Clinic. Our values are fun, yep.
And
creativity and passion, and because the children are feeding off that excitement, we seem to see a lot more compliance in the clinic.
Yep.
We also know that we're taking away the role of the parent and there's a third person stepping in to do the hard stuff.
Yes.
So we give you home programs and home ideas, but life's really busy and parents, as you know, are busy, and especially our parents that have children with special needs or difficulties, it's even harder, the role at home and across the community, and we're mindful of that. So we don't want to give you a home program that's too difficult to do. We might say we'd love you to practice 3 or 4 times a week with these activities, and the reason we give you those activities are you're clinically reasoning that, like, why would you need to pinch the putty 5 times, 3 times a week?
Yes.
So that you can actually hold your pencil well. So any activity that's given is for like visual perception. We'll say let's do some mazes, and so with every kind of area of difficulty we'll just clinically reason the correct activities to practice at home.
Right. And so as a parent, firstly, why do these kids sort of fall behind? Is there any particular reasons why they're falling behind? Obviously some have certain conditions. Are there other things that we need to be careful of as parents, or is it just sometimes kids just are a bit delayed?
Yeah, and again, these are great questions. So I think that's one of the big things. Why is the gap widening?
Yes.
And I think sometimes it's less exposure to an activity. So if a boy comes into the clinic and he hasn't done a lot of drawing or colouring in preschool, he often comes to holding his pencil and we get a fisted grasp and we get these whole arm movements, and the reason is because he hasn't actually developed those finer or smaller muscles by doing.
Mm-hmm.
So we practice, we plan, we act, we do, we learn those motor skills. So exposure to different activities, whether it's climbing, being in the playground, whether it's swimming and learning those strokes, building our muscles. The more children can do, I think the more they improve. I think the gap will widen as well if you have delays. So you actually have a neurological, biological disorder. You would have a developmental delay or a global delay, and global delay will mean their sensory, their motor, their reading, their writing, everything's behind peer level. So
yes.
We don't then expect those children to come in at that level. We will assess in the baseline, and then we'll work out a plan that they'll gradually increase, and start to close the gap between them and their peers. Are we going to close the gap completely? I don't always think we can,
yep.
but we do absolutely all that we can,
yep.
and parents do what they can. And honestly, some of these children coming through the clinic in the last 4 years we've been practicing, I'm so proud of them that it's just incredible to see their results awesome. And how they are today through just these dedicated families
yep.
coming fortnightly.
And making it happen.
Yeah, weekly, an hour, a fortnight, whatever they do. They are the ones at home that are doing the most. They are amazing.
Well, that's it. That's the job of the parent, really, isn't it? To really get behind their kid and make it happen. So,
yeah.
And one just quick question, just a quick one. We were talking a bit before about devices. Do you think that all the devices that we have and all that is actually hindering some of the development of some of the kids today in our society?
Yes, I might get in trouble for answering this,
yeah.
honestly.
Okay.
I hide my head when I tell you. I think if parents can put down their phones, kids can put down the devices, get outdoors, play in a sandpit, Go home, play a board game, play Snap, play like the things you learn through play. It's so important for our children to be down on the floor, spending time with mum and dad. That interaction, that love, that care, that just helps build their emotional resilience. Their the kids that are busy gaming, I can understand why they're doing that. Sometimes they have a gaming disorder, so I know, to be compassionate for those children that can't put the device down, or they're really, really addicted to iPads, and I get that part. But I also say to families with young children, early intervention and what you do from a very young age impacts later their resilience, their anxiety or their fears. They need to be risk-taking to the point where they're learning and planning and executing and going, oh, that didn't work. I fell off that part of this. Even falling and tripping over. They're learning. Like, that's a big part of what we're going to do.
Absolutely.
Put down the phone, spend an hour, 30 minutes a day just playing. Let's be pirates in the bedroom. Let's run around the house and play hide and go seek, because that's going to be a huge impact.
Absolutely, that's so good. I've been a pirate many a time, so my
Yes.
One last question.
Yeah.
For parents out there, can you give us maybe 3 tips when it comes to our kids, that what we can do? You sort of alluded to a little bit about playing and being involved, but what are your 3 big tips about parenting and what we can do to actually help our kids to process things well?
Yeah, I think, so being helpful as a parent, but not always doing for the child. So I always say to the parent, please let them try and fail, or please let them try and try again. We often jump in and let me put your shoes on because we've got to get you to school. No, let's get that child to try and do it themselves. And the more they practice and the more they have the repetition and the rehearsals, the quicker they learn the motor pattern. So we often do too much in some regards because we're in a rush, we're in a hurry. So please let your child try and fail, because we don't want them to fail, but eventually they succeed if they keep practicing. And play and early intervention's key in a child's future development. So get down on the floor, play, animal walks, whatever you can do. Using our bodies in play, so we learn the motor skills, we strengthen our muscles. That's all key for OTs. We always say, oh no, has that child been sitting up at a table doing some handwriting or drawing or colouring in? And if they haven't, they need to be doing that before school. So we need to be doing school readiness stuff so that when they get to school they can actually succeed. Set them up for more success. Again, it's interacting with your child and enjoying that time. Like, they grow up so fast.
They do.
Yeah, go back home and do those fun games in the yard, outdoors.
So good. Look, thank you so much, Sarah. That has been
so
amazing information, and I'm sure you guys have really got a lot out of that today. Look, if you want to find out any more about the Rainbow Clinic, come down and check it out. It's an amazing place. I'm sure that these guys will be more than happy to answer your questions and help you out with some of the potential issues that you're seeing in your kids. All the information for their clinic will be on the screen right now. Look, thank you, Sarah.
Thank you. Thanks for coming.
Congratulations on an amazing place, and all the best with everything you're doing. And thank you, everybody. No worries, thank you.
Thank you, everyone, for watching.
Remember, same time next week, 12:30. I'll have another incredible interview for you. Remember, healing is a gift, health a responsibility. See you later.